name is Dr. Kamal Abdul Naser. He's got MBBS, MD, FRCP, and he is also a fellow of American College of Endocrinology. Dr. Kamal Naser is a general consultant who is working in Midland hospitals, and he has special interest in endocrinology and diabetes. But currently he is involved with lots of COVID patients, and he is treating day in, day out, and this is his day-to-day job at the moment. And we are pleased to welcome in our show to share his experience and what they are doing for all these patients. Please welcome Dr. Kamal Abdul Naser. Hello, Dr. Naser. You're online
Hello,
with us.
Good evening. Yes.
Good evening.
Yes.
How is
Good
the traffic in Midlands?
All roads are empty. You can drive very quickly. Yeah.
That sounds good. It's quite similar in our area as well. In Barking, yeah, it took easy drive. Things are getting better. But what are we doing? What are we doing with this virus around us?
Yes. In UK, I think London and major cities like Birmingham are getting really busy with COVID-19 patients. But in our part of the country, we haven't still reached peak, but still we are getting patients. They are mainly people with old age and medical complications.
Would you like to say something about COVID-19 in short, so then our viewers will understand what we're talking about? I know they all know about COVID-19, but they would like to hear from what you say about.
Yeah, I think even a small child knows about coronavirus now. You know, everybody's talking about coronavirus. However, this coronavirus is a family of viruses, and it has been known from 1950s. About 1/3 of the common cold is caused by coronavirus. And this particular virus causing this epidemic is called SARS-CoV-2 or COVID-19 virus, which is a mutation of the generally known coronavirus, which started in China. So this being a new virus, though it's a family of coronavirus, it's a new one for which we don't have immunity. So it's going to affect a big chunk of the population, and therefore, even though the death rates are going to be very low, we are going to get a bigger number of deaths in a very short time. And the big difference between the other viral infections and this one is this COVID-19 seemed to be quite contagious and seemed to be spreading very, very fast.
Are these two viruses same? Sorry to interrupt you. The Wuhan, the virus which started in China, and we have something going around in Italy, Europe, and in England. Are they same virus or is it different?
It's the same virus, but there are the virologists have found sort of isolated two types of viruses, an S type and an L type. Seem to be sometimes more virulent, and some people are talking about whether the virus has further mutated. Generally, virus epidemics, like when it happens, what happens generally is that these viruses mutate and they become less virulent and they die down, and then the epidemic sort of calms down. But however, now at this moment, we don't see that trend. So we don't know whether it has mutated, but it's all like, new to us. And it's for most questions, we would say we don't know. Like, it's very difficult to answer in a solid sort of term.
So this mutations means, will the virus become more severe? Will it kill more people? Or on the other side, can it become a milder form? It become friendly and do something good for us?
It can happen. Generally in viral epidemics, it happens. Like, after some time, the virus keeps mutating and then it becomes less virulent and then it causes less damage, and then the epidemic ends. So we never know, but what's happening around Europe seem to be, it doesn't seem to be like, becoming less virulent. If you take Italy and Spain, still they are having a quite high number of deaths, and even in UK today there had been quite more than 500 deaths today, 523 deaths today. And the total number of cases seem to be around 30,000 diagnosed. But we should be very careful in analyzing this data. Like, if I would say 30,000, around 30,000, 29,000 plus patients are admitted to the hospital, they are the ones who are tested and confirmed. But there are lots of patients in the community being not tested. They're having fever, they're having cough or aches and pain. They've been told to be self-isolated.
Do they really need a
just
test?
Can't say it's 30,000. It's very high. The number of patients will be quite high in the UK.
Okay, do all of these patients, do they really need to be tested? So we are going to test only patients who need intensive care unit, or they need hospitalization?
In some countries like South Korea and now in US, they test lots of mildly symptomatic patients. Even if you have a sore throat, they are testing them. To test more, it may be easier to control the epidemic. However, there is a problem with the supply of these test kits to every country. It's a worldwide problem because it's a new problem, new infection. So you can't immediately produce test kits and all the reagents and things. So there's always a problem with the reagents. Therefore, in UK, now what we are doing is only people who are admitted to the hospital with severe symptoms are tested, and for the NHS staff, even for NHS staff, not everybody will be tested. So if you test everybody with symptoms in UK, you will find a lot more cases. However, the advice from the NHS and the health department is to for people with symptoms to self-isolate, therefore they don't spread the disease. So whoever gets symptoms will be self-isolating.
Okay, so I understand, like if I get a mild symptom like a small sore throat or a runny nose, a little fever, I just self-isolate myself, and I don't have to be tested. I'm still fine, isn't it? So, okay, let's go, let's talk about a little bit more. How does this spread around, and how does this infection goes from one person to the other person?
Yes, it's mainly from respiratory droplets. That is, if you sneeze, if you cough, or even when you are speaking, you might sort of throw your sputum from your mouth. And it can reach up to about 2 meters. So that's why we ask people to be separated by 2 meters. So these respiratory droplets can be directly inhaled by people if you're closer to people, or when these droplets settle in a surface like a desk or any other hard surface, or a wall, or a knob of a doorknob or whatever, wherever it's deposited, if someone touches it, and then that person carries the virus in his hands, and when he touches his nose or the mouth, the virus goes into the mucosa of the mouth and the nose, and then goes into the system. So that's how it spreads. So it's very contagious. And still, there is a debate whether they can be airborne. Now the current thinking is it's not airborne. However, the respiratory droplets can stay in the air around 2 meters around this person for about 1 to 3 hours. So there is always a debate about whether this is airborne. However,
when you say about these droplets, I have 2 questions just coming out of my mind. It's like, well, if I live with my family, do we have to isolate each other? And the second question, like in a common place, me wearing mask and everybody else wearing mask, will it help?
Yeah, the first question is now the government advice is for every family to be in their houses. So that means it's everybody is practically quarantined. The whole country in worldwide, that's the advice. In some Asian countries, they have lockdown cities and curfew in cities, like you can't come out of the houses. So that means you are practically in a quarantine situation. If you are like within the house, if you are asymptomatic, that means you are not showing any symptoms, you don't have fever, you don't have cough or sore throat or aches and pain, and then you are called not symptomatic. That means you are probably not having an infection. In that case, you don't need to be isolated from your family. Your family could be together. Like you can't be within a house, you can't be 2 meters away from a person. However, if you are going out in the UK setup, you are allowed to go out for your essential shopping. If you are a key worker, you are allowed to go for work. And if you are going to do exercise, you are allowed to go out once a day. So if you are going out, you should keep a distance of 2 meters from the person. And if you are showing any symptoms like fever, sore throat, pains, aches and pains, or lethargy, that means you are feeling so tired, or you are having runny nose, sneezing, coughing, then you shouldn't go out in the community. You may be a person with COVID-19, so you shouldn't go into the community. In that case, you should be isolating yourself.
What is, when you say about isolating, I just think about like, what does it mean by incubation period? I mean, NHS is giving two different guidelines. Some people stay home 7 days, some people stay 14 days, and generally people get a bit confused with this medical term, incubation period.
Yes, let's look at the incubation period first. Incubation period means like you are exposed to the virus. You never know when you are exposed to the virus. Say if you are exposed to the virus today, you can develop symptoms like fever, cough, or shortness of breath or sore throat from 1 day to 14 days. So majority will develop symptoms within 5 to 6 days. Nearly everybody will develop symptoms. Nearly everybody who has got the infection will develop symptoms by 14th day. So if you have not developed symptoms by 14th day after exposure, then we can say, okay, you have not got infection. That's the incubation period. And now
Dr. Kamal Abdul Naser, I'm just going to interrupt you for 1 second. We just got a call online, and there is someone online and who wants to know that if you get a symptom today, like cold, runny nose, and a little bit of fever today, and tomorrow he says, if I'm fine, do I have to go and test myself? Sorry for the interruption. If you could answer this question, and we go ahead with the previous one.
Yes. If you develop symptoms, it could be from very mild symptoms like aches and pain, cough, or sore throat, or very mild fever. You may even recover within a day or two. Some people would recover very quickly, depending on your immunity. Some people would take about 5 to 7 days to recover. So if you develop symptoms, according to the current guidelines in UK, you don't need to be tested unless you are very, very symptomatic. What are these very high-risk symptoms? Like if you are running very high fever and you are feeling very, very unwell, you think you can't cope at home, and then you should seek help. You should ring 111 and then follow the advice. Or if you are having a continuous cough for more than an hour, or you are getting 3 or more bouts of cough within 24 hours, you should contact the NHS 111. And if you really become short of breath, yes, you think you are getting short of breath, which was new, and then you should contact the NHS 111. Or if you think it's real emergency, you should ring the 999 and call the emergency. Otherwise, what you should do is you should stay at home, take some paracetamol if you have fever, drink enough water, rest, and take a balanced diet. That's what you will really need.
That's quite a good summary of for the question. But have we finished about the incubation period, or shall we pass?
No. So the incubation period is, as I said, it could be from 1 to 14 days. Majority will develop the symptoms within about 5 to 6 days. However, say if somebody has developed fever or any other symptoms like aches and pain or sore throat and fever and aches and pain are the most common symptoms. So if you develop these symptoms, what the NHS guideline says is you should be self-isolating for 7 days. This is for a person who is living on his own. If he's alone at home, he should isolate himself for 7 days, and then he can go back to work or whatever. However, if you are not going to work, if you are not a key worker, you should still be, even after 7 days, you should still be at home because you need to be following the government guidelines to be at home till this epidemic is over or the government says you can go out. So the self-isolation for a person who is alone is for 7 days. Say you are with the family. You are with the family. You have a few kids or 2 kids and your wife, and you got fever, sore throat, or aches and pain, or cough. Then what you should do is you should isolate yourself in your own house, isolate in a room, and then use a separate toilet, or if you have not got a separate toilet, you use the toilet after everybody else has used, and you use all different sort of separate utensils, separate towels, and keep some tissues and put it in a bin and in a double bag it. So you should take all the care not to expose others in your house. This channel being watched by Asians, I should give very important information to Asian families, because Asian families are living with their elders. So there'll be elderly people in your house. So if you develop any symptoms, immediately either you can separate them in a room in a house, because the elderly are at risk of developing complications, or you can move them to another house where either your family members or friends can look after them. So you should care for your elderly. If your elderly relatives are living in another house, in a separate house, they are living there on their own, and then you don't need to worry, but they should not come out of the house. You should not visit them. So that's quite important. So that's the most important message you should get. And the other important message is, if you are self-isolating and your family has not got symptoms, then the family should be isolating themselves for 14 days. So altogether, if you are with the family and one of the family members is having symptoms, the whole family should not come out of the house for 14 days. So the self-isolation becomes 14 days if you are with the family. If you are alone, it becomes 7 days.
7 days. If someone in the family, like let's say my child got infection, and then I think it implies for me to stay 14 days self-isolated. Is that correct?
Yes, yeah.
Okay, before we go to the next question, I would like to receive more calls. And please, if anybody would like to put your questions forward on our special channel, our telephone number is here, is 0203 515 5788. And you can follow us on Sky Channel 782 or on our Facebook channel. It's ION Facebook line. And okay, we're going to jump into the next question. It's what does it mean, quarantine or self-isolation? It's people get a bit muddled with these two terms.
Yeah, quarantine is done for somebody who was exposed to an infected person, or in some countries, I don't think we are doing it in UK. If somebody is coming from abroad where this person could have been exposed to the virus, they'll be taken to a quarantine center in some countries. However, in this country, if you return from, say, Italy or Spain or China, or for now at the moment, I think anywhere else, if you come from any other country, you should be quarantined for 14 days. That is because you may be carrying the virus and you may be already infected with the virus. You are not showing your symptoms. Therefore, you should be quarantined for 14 days. That 14 days could be spent in your house. So that's called self-quarantine. In some countries, they would take you to a quarantine center and they will monitor you, and then only after 14 days you will be released. That is because the symptoms can develop after up to 14 days. That is quarantine. However, the isolation is something that if somebody develops symptoms, that person is isolated to prevent infection getting to another person. So that is isolation.
Is there any way to prevent this disease?
Yes, we give a general advice. The most important advice is social isolation. That's the most important advice. So that has to be practiced by everybody. Even some people think, oh, I wouldn't get the infection. Even if I get the infection, it wouldn't affect me. I'm not going to die because I'm going to get mild infection. That's not the case. That's not the case, because you should worry about the society as a whole. If a young person goes around and he spreads the virus, and then the elderly and the sick people are going to die of that. Therefore, everybody should take their responsibility as social isolation. That means you should reduce your movements. You shouldn't go out of the house for unnecessary reasons. For very essential reasons I mentioned above, like exercising once a day, or shopping, or very urgent medical needs, or if you are a key worker. And then you should go out, minimize your stay outside, and keep 2 meters away from other people. So that's the most important thing. Number 2, wash your hands properly with soap and water. You can find videos of how to wash. At least spend 20 seconds. Spending 20 seconds, wash your hands properly. If you go out, always wash your hands when you come in. And if you touch any surfaces, wash your hands. And if you sneeze or cough, again, wash your hands. So keep washing your hands. That's very, very important. Other important thing is, people tend to wear a mask when you go out. That seems to be very, very sort of rare in this country, but I still see people wearing masks. If you are wearing a mask, you should be very careful with it, how to wear the mask. If you are, I'll show you a surgical mask, which is, I've seen people wearing this mask. If you're wearing this mask, make sure that you take this mask. When you're wearing, there's a metal piece here, just properly shape it to your nose so that there's no gap here. And then this mask could only be used for 3 hours. If you wear this for more than 3 hours, it can be counterproductive. And then again, I've seen people wearing the mask and then touching the mask here and there. So that is going to cause more harm than wearing a mask. So therefore, if you decide to wear a mask, wear it properly. Otherwise, don't wear the mask. However, the current guideline is the public should not be wearing mask in public places. That's the current guideline. And the other important thing is, if you're coughing and sneezing, you should use tissue and then catch the cough and sneeze with your tissue and then bin it properly and in a covered bin. Or if you can't find a tissue, use your elbow like this. To cough and sneeze, use your elbow, and then after that you can wash later. So those are the most important sort of health tips you should get into your mind. And most important thing will be to reduce your movements and maintain social isolation.
Before we go to the next question, and then we're going to have a break, there is a caller online. I think I would like to take that call, please. Yeah, hello. You are connected? Can you hear me? Okay, I think we have lost that connection. There was another call I received, and this person is asking if he has got coronavirus. Can the disease be transmitted to his cats or dogs?
Very unlikely. However, we don't have enough data. So therefore, I would say I really don't know. Because it's a new disease, we don't have a lot of data about this. But in few case reports, there have been sort of
Okay.
transmission to other animals. However,
Excellent.
I would say it's very difficult to answer.
Okay, Dr. Naser, we're going to get the call back again, and he's back on our line. Hello, you are connected to Ian's Health Talk with Dr. Akram.
Hi, doctor. I want to know, is it possible to take the chloroquine, the malaria tablet, as a precautionary measure in order to prevent from this coronavirus?
That's a quite interesting question, Dr. Naser. We were thinking to discuss that in the future, but what shall we do? Are we going to answer that question now?
I would say no to that question first. I wouldn't advise anybody to take chloroquine as a prophylactic medication. That means to prevent the disease. There have been no studies, no data, and it's not recommended. It can give side effects sometimes. Therefore, the dosage has to be correct, and it can have interactions with your medication, so it has to be prescribed by a properly qualified person. However, there are research studies done in China and France. The Chinese studies have not yet been published. And France, they have published 2 studies showing that some improvement, some beneficial effect in hydroxychloroquine, and then they have studied azithromycin in combination. However, they are all studied in hospital-admitted coronavirus or COVID-19 positive patients. In US, it was discussed in press conferences by political leaders, and I hear that some people have taken the medications, and even we have heard that one person died of side effects of hydroxychloroquine. So therefore, these are all still under research, nothing proven about the benefits, and there's definitely not to be taken as a preventive measure, and therefore I would say we shouldn't try to take these medications.
That's a great question. Before we go to our next question, we're going to have a short break. Please be online, and please don't tune off your TVs. And we're going to catch you back again soon in Ian's Health Talk with Dr. Akram. Be tuned. See you soon.